What leads to hypercapnia? So hypercapnia is when there is too much carbon dioxide or CO2 in the bloodstream. This can be caused from hyperventilating, so you're not being able to get enough oxygen into the lungs. It's also very common in people that smoke, or so cigarettes, cigars, pipes, stuff like that. People that suffer with COPD as well, who have flare-ups, that can also increase the chances of getting it as well.
Okay, so clinical signs and symptoms of hypercapnia. Clinical signs include flushed skin, full pulse, rapid breathing, premature heartbeats, muscle spasms and hand flaps. Symptoms of hypercapnia would be shortness of breath, anxiety, headaches, and feeling fatigued and lethargic after little exertion. So after getting a good night's sleep, feeling very tired still.
Okay, so looking at why hypercapnia can occur in trauma patients. There's a few different reasons for this. One being blunt force trauma to the chest, causing pulmonary contusions and rib fractures, linked to increased mucus production, thus reducing the rest rate. Another reason, traumatic brain injury, neurological damage, and there's a link between increased intracranial pressure and pulmonary edema. This also can reduce the rest rate. So then all that together, you've got respiratory failure. So there's a lack of expulsion of CO2 from the lungs, leading to hypercapnia.
Capnograph is a useful tool for monitoring respiratory functions, particularly in regards to hypercapnia. The hypercapnography measures the concentration of CO2 from exhaled air from the lungs. So a normal graph that you can see on the right is you've got 3 phases. It's a square wave pattern, which begins when you inhale and continues until you exhale. And the peak of that is the end-tidal CO2. So phase 0 is when you inhale. The graph remains a straight horizontal line. There's a lag between the inhalation and the latency, so you get the spike at the end of the inhalation. And then when you exhale, it's the beginning of the expiration, leading to the increase with the curve of the peak with the CO2. And phase 3 is plateau, reflects the end tidal expiration, which is the ETCO2. End tidal CO2 is a peak measurement and is a reliable index of effective heart compression during CPR, which is associated with cardiac output. The first sign of ROSC during CPR is an increase in end tidal CO2. Studies have shown if you've got more than 10 millimeters of mercury or less, cardiac arrest was associated with death. If you intubate someone using endotracheal intubation, you can confirm the location that the tube is in the correct place, and that was seen as more reliable than auscultation. Capnography is considered as a simple and non-invasive method to detect and estimate shock intensity at an early stage. So if a patient was in shock, that can detect that, and as evidence shows, can affect the news scores, etc. Low end-tidal CO2 has a strong association with shock in patients with trauma and can be used to improve triage and help paramedics decide to pre-alert to a major trauma center if required.
For treatment, you can use multiple treatments for hypercapnia. If you have severe symptoms, you could be put on a ventilator to make sure that you breathe adequately. There are non-invasive ventilations where you use an oxygen mask mainly at night to ensure that you continue to breathe. However, there is also invasive ventilation where you are intubated to help you breathe. These treatments will allow you to get consistent flow of oxygen to balance the CO2 levels. There are also medications that can help enabling you to breathe better. Here as follows. You can also use therapies such as oxygen therapy to help treat other symptoms. You can carry a device around that puts oxygen straight into your lungs, giving your body the right amount of oxygen to breathe. There is also surgery to help treat or replace damaged airways or lungs. Lung volume reduction surgery is where damaged tissue is removed to help the remaining healthy tissue of the lung expand and bring in more oxygen. Other treatment is to change lifestyle, eating healthier, stop smoking, and taking up light exercises is the best way to do it.
Okay, that's the end. Thank you very much.